Hi, welcome. My name is Jerome Matthew. I'm going to discuss about the Article 2, the prevention and treatment of obesity. Let's move to the next slide. Um, Everybody know that obesity is one of the most uh, uh, risky diseases in the current world. So the articles is an analysis through the different kind of research conducted in the reduction of obesity, and everyone know that it's highly prevalent in adult population. Adult ones are going to obesity during their 20s, and the article go through the negative impacts on health of by obesity and importance of effective prevention and treatment. So everyone know that there is a metric known as BMI, basal metabolic rate. People consider a person obese or overweight according to this metrics. People above 30 considered as obese, and people between 25 to 30 is comes under overweight. So obesity is dangerous than overweight. Yeah, it can cause a lot of other conditions such as fatty liver, type 2 diabetes, many other lifestyle diseases. So the goals of this article is improvement in obesity related risk factors, reduction in obesity related diseases, lowering of risk of early death, prevention of inability to work and early retirement, reduction of psychological physiosocial disorders, improvement of quality of life. Okay, let's move to the next slide. Okay. The research methodology of this article is from different areas of science, scientific literatures. So they researched between 2005 to 2012 through all the scientific literature at that time. Then they examined almost 4,500 abstracts. Then and they analyzed 190 publications from different part of the world. Okay, let's see. So obesity is a chronic disease. According to World Health Organization, they consider obesity as a chronic disease, and they define it as an abnormal or excessive fat accumulation that presents a risk to health. A body mass index, which is BMI, over 30 is considered as obese. Okay, let's see. So the article says that according to um, some reports, after the pandemic, the obesity increases because of the sedentary lifestyle. Let's see. So the dietary recommendations for obesity to reduce the obesity: an energy deficit of 500 to 600 kilocalorie per day will allow weight loss to occur around 0.5 kilogram per week over a period of 12 up to maximum of 24 weeks. So to reduce obesity, taking a energy deficient diet is very important. Some people says no need of diet, we can go to the gym, but the article says it is not possible. So this saying 500 at least 500 to 600 between that range of calorie deficient is very important for to reduce reduce obesity, which means fat loss. Reduce both fat and carbohydrate, reduce then they saying that reduce both fat and carbohydrate consumption. Moreover, temporary use of formula products for BMI below 30 kg per meter square at 800 to 1200 kcal per week. That is also very useful for reducing obesity. Let's move to physical exercise. Everyone know physical exercise is very important for reducing obesity. It's not only the cardio or not only the muscle exercise, both kind of, which means all kind of physical exercise is essential to uh, decrease our weight, sorry, obesity. Efficient weight loss require at least uh, 150 minutes per week or energy consumption rate of 1200 to 1800 per week. Well-controlled studies and meta-analysis shows a weight reduction of about 2 kg and about a 6% loss of abdominal fat in 6 to 12 months. Behavior modification. At nowadays, we know we are using social medias and many other kind of internet things. So we know behavior have great influence in people now. So we can so we can improve uh, our uh, our we can improve the reduction of obesity by some kind of behavioral techniques. Okay, so here it says that support for changes in nutrition and exercise. So they say the behavior modification will help, like for example, like motivation. Some people consider, some dietitians and doctors, even doctors prescribe their client to believe that they are losing their fat. So thereby, even for me also, when I joined in the gym, my gym master always said that, Jerome, you think in brain that your fat is going to reduce and give a lot of motivation. So behavioral therapy is related to that kind of psychological stuffs. Okay, weight loss program. So the main important weight loss programs are programs preferred by the article is diet therapy, exercise, behavioral therapy. So these three are a scientific method that can reduce our body weight. Everyone know that there is also drugs. Some people always try to use the drugs prescribed for cholesterol. People who uh, preferred for cholesterol, they know some kind of drugs is very useful to uh, reduce the fat absorption from our gut. So but it is not a recommended method to use drug always, because lot of risk in using the drugs. So the article suggests only one drug, orlistat. Okay, the only drug that may be considered is orlistat. Orlistat treatment is indicated in patients with a BMI above 28 who also have other risk factors or comorbidities. Okay, so the only preferring drug is orlistat. Surgical intervention. So people who need sudden fat loss can opt this method. For extremely obese patients, surgical intervention should be uh, uh, considered. So it's considered. Compared to conservative treatment, surgical treatment is more effective in terms of body fat reduction uh, and reduction of mortality risk. So everyone know that the surgical method, they uh, removing some part of our stomach. Uh, but for some people it is very successful, but some other people the surgery is successful, but after they became obese because of their sedentary lifestyle again. Controlled study. So the controlled studies say that weight loss achievements within 1 to 2 years. It's fine to get weight loss within 1 to 2 years. Dietary therapy will help to reduce 4 to 6 kg. Exercise therapy can help to 2 to 3 kilogram per month. Bariatric surgery can suddenly take 40 to 20 to 40 kilogram. So there's a different kind of studies for different therapies. So conclusion. In conclusion, there is no singular method for effectively reducing obesity. It's a truth. We cannot reduce the obesity in one method, like a capsule, eating a capsule and reducing obesity. It is not possible. So, so it's a combination of different methods. I already said that the behavioral therapy, diet therapy, exercise, taking meditation, taking motivation. So through all this complete method, we can reduce the therapy. So let's move to the Article 3, the circadian regulation of nutrient metabolism in diet-induced obesity and metabolic disease. So the article is mainly related to a circadian regulation of nutrient metabolism. Like all other animals, our body have a circadian rhythm to maintain all kind of activities. So the article deeply focuses on strong correlation between obesity and commodities such as type 2 diabetes mellitus, non-alcoholic fatty liver disease, cardiovascular disease, and COVID-19 severity. 40% of US adults considered obese, highlighting the urgent need for prevention and treatment. Effect of circadian disruption on metabolic health. I will. I can no need to read all of these things. I can tell you simple. So our body have a circadian rhythm. So we should we should if the rhythm if the rhythm not goes well, it affects our health. Okay. So they're saying that nowadays people are working. Basically, we are animals. We have all things similar to animals. So yeah, we are living in a working era, so we have night shift, day shift. So when we doing um, unrhythmic things such as not we working in night and not getting well sleep, so this will all affect our health and it's affect our rhythm of our body. So the word circadian comes from a Latin word which means about and dies meaning the day. So it's basically it's a little bit complex, so I can I believe I try to say it simple. So mainly there is two kind of GMT, ALFL, and SCN. When the sunlight hits our hypothalamic suprachiasmatic nucleus, it tell our TFL to maintain all kind of things. For example, when the sunlight passes through our body, it will trigger increases the glucose absorption for uh, in our gut. So it's like that kind of things. So it's like a sensor, a natural sensor. You understand? So this works as like a sensor. So if when we not live according to this right schedule, it will affect our all kind of things and it will lead to obesity. Okay. So the studies conducted in rodents says that positive impact on time restrict feeding on metabolic health. So they invented a method known as time restricted feeding, which is giving the right food at right time. So it helped to it gives a positive feedback by reducing the obesity. So simply say obesity is a circadian disease. Nowadays people are not working well, just sleeping and looking mobile phones and laptops and sedentary lives with the circadian rhythms affecting the right metabolisms are not doing well inside of our body. So finally it leads to uh, diabetes or fatty liver, that kind of diseases. So the conclusion is circadian clocks is very important for in regulating metabolic performances. Potential therapy leveraging circadian rhythms, including time restricted feeding. So time restricted feeding is the right thing. It's very simple. Eat food at right time. Eat food at breakfast, lunch, dinner. You know, even me for some days don't eat well because we have no hunger. So I know it's danger, but it's part of our life. It's okay. And the other method is therapeutic interventions. So thank you all. This is reference. Thank you.